Well, all day we've been focusing on the opioid crisis from the perspective of how it came to be, the way that it destroys lives and devastates families.
Yeah, but what about treating the addiction? Can someone just stop? Is that dangerous or even possible? For the answers, we turn to Dr. Frank McGeorge with a perspective on the elements to breaking the chains of addiction. Doc?
Well, Devin and Kimberly, I'm here in the Local 4 phone bank with addiction experts taking your calls. Now, the number on your screen is 844-WDIV-HELP. Now, remember, addiction does not take the same form in everyone. That means the answer to getting clean is also different for everyone. The most important thing, though, to understand is, as difficult as it can be, there is hope.
A lot of times when patients come to us, they are in a very dark place, and this doesn't make anyone a bad person. This is a disease that we just need to get help and get your life back.
Dr. Elizabeth Boulat is an addictionologist and the medical director at Henry Ford's Maple Grove Addiction Treatment Facility. She says recovery is a process.
The patient first has to be ready, because we get a lot of patients that do come to us externally motivated, legal issues, spouse, job. The patient has to be ready internally. I think that's the first step to get help.
Once a person is ready, some try quitting on their own, either stopping cold turkey or by gradually decreasing their dose. And while some people are successful, Dr. Boulat says they are in the minority.
It's a chronic disease, so again, doing it on your own is going to be a little bit more unsuccessful than getting into treatment.
The withdrawal from opiates feels like having the worst case of the flu ever. Body aches, nausea, sweats, chills, headaches, runny nose, crampy stomach pain, and more. It won't kill you, but it will feel like it.
I don't see the point of making somebody suffer if we do have advances in medicine that we can help patients.
Medication-assisted therapy, as it's called, is prescribed by an addictionologist. There are 3 commonly used medications: methadone, buprenorphine, and naltrexone.
Methadone, which is typically, that's going to be something for addiction that is coming from a government-run facility that's federally regulated, and patients can go there. That is an opioid replacement therapy. It's just a longer-acting version.
Buprenorphine is similar to methadone because it activates opiate receptors in the brain, but its effects are partial, limiting the discomfort of withdrawal without producing an opiate high.
That is something that we use here for detoxification, also maintenance, and that sort of makes the patient's withdrawal symptoms go away, but also takes away their cravings, and we can do that in a tapered fashion.
Now finally, there's naltrexone, also known as Vivitrol. It works by blocking opioid receptors, not activating them. That means it cannot be used until a person is clean from opiates. Administered as a once-a-month shot, its biggest downside right now is its cost. Now, there is some debate over the use of methadone or buprenorphine, opiates themselves, to treat an addiction. But to Dr. Boulat, the end goal is clear.
We're just trying to get them their life back, quiet down those cravings, get them back into some sort of normalcy, and then tapering down. So my end goal is abstinence for everybody, but sometimes we have to take medication to help them.
Now, even with medication assistance, getting clean is still unpleasant. But Dr. Boulat really points out something. That discomfort is good because it often helps recovered addicts remember that this is something they never want to experience again. Back to you.
It's so tough. All right, Doc, be sure to stick with us. Our primetime special is coming up tonight, 10 p.m. We will hear from doctors, from addicts, even a former drug dealer on how he believes we can stop the opioid crisis. Live tonight on Local 4.